Hello. Start a little too quickly there. So, hello. Hearing is essential for maintaining relationships and connections with friends and family, all while still being able to fully participate in life events. It's a vital sense that makes it possible to engage, listen, laugh, and enjoy many of the things that help shape your quality of life. Greetings, I'm Michael Hidman, Executive Editor of Herald Community Newspapers, and your host this evening for yet another Herald Inside LI webinar. Tonight, we are focusing on the hearing clarity solution that's improving your mental acuity and quality of life, all with better hearing clarity. And who better to share exactly what all that means than Dr. Lawrence Cardano? He's an audiologist certified by the Board of Audiology, who also is a certified dementia practitioner. He's co-author of the book, Stop Living Your Life Disconnected, which he wrote with neuroscientist Dr. Keith Darrow. Dr. Cardano has also authored the recently released book, The Hearing Clarity Solution, as well as the monthly newsletter, Long Island Sound, which provides timely information and advice on hearing loss and healthy aging. Dr. Cardano is a frequent speaker on the topics of healthy aging and the treatment of hearing loss and tinnitus. He's been director of the Hearing Center of Long Island since 1996. There, Dr. Cardano and his staff provide advanced personalized treatment of hearing loss and tinnitus and have helped improve the quality of life and maintain related cognitive function for thousands of patients. And I also can't forget to mention that Hearing Center of Long Island just won the Herald Long Island Choice Award for Best Audiologist and Best Hearing Aid Center. So, Dr. Cardano, that's a lot of great information about you, but you're eager to share with us all about hearing clarity. So, how are you feeling this evening?
I'm excited, and I'm so glad that you invited me here. I'm looking forward to it. Yeah.
Excellent. Well, fantastic. So we just jump right in?
Yeah.
All right. If so, Dr. Cardano, take it away. The floor is yours.
Very good. So let me just mention a couple of things quickly. I'm going to see if I can share my screen here. And let's try this. Okay. All right. Okay. So we're going to talk a little bit here about hearing clarity. Now, I'm not sure. You each may have your own reasons for coming today. Usually before I start, when I go to a seminar or I attend a webinar, I usually like to know who it is that's presenting this and why I should listen to them. So I'll just mention, in any of you who haven't heard of me, so I am Dr. Lawrence Cardano, Director of Hearing Center of Long Island. And as you heard, I'm a certified audiologist and dementia practitioner. I've been working with people who have hearing clarity problems and tinnitus for over 20 years. And as you heard, I'm the author of co-author of a couple of books. And my secretary told me that I had to include this slide. So I apologize, but thank you. We're very gratified that I'm able to win the Long Island Choice Award just a few weeks ago for Best Audiologist. All I can say is that I'm going to do everything I can to make sure I've earned it. But more importantly, I think we should get clear before we start. I want to get clear why I'm here, and I'd like to know a little bit about what I'm curious about why you're here. I know we did get some questions that came in. I will tell you that I'm here because I've dedicated myself and my practice to helping people improve and maintain their quality of life and cognitive function with better hearing. I know from the questions that you have sent in before this seminar that some of you have concerns about better hearing clarity. Some of you have concerns about tinnitus. That's not the focus of today's presentation, but I will get into that because that is one of our specialties, treatment of tinnitus, and some other questions I know that you've had. Okay, so here is some of the basic outline of what I thought we would get into today. And I don't know if we can have anybody, Michael, are people able to type anything into the chat box? Is that possible?
That's a very good question. I don't believe that we normally have the chat turned on for that.
Okay.
But we'll check to see if we can. If not,
Okay.
we've already got some questions, and we can try to send some more after the fact too.
Okay. If not, I think what we'll do is we'll make sure we have some time towards the end for people to submit their questions. So as we go through this, if questions come to mind or comments, maybe you want to make a note of them, so we make sure that by the end we can address those. Um, so one of the so first, I think before we get into this, we have to think about. I have to know, why is hearing clarity important? Does it really matter whether you hear clearly or not? Um, and why is it difficult to solve? This reminds me that I saw a patient not too long ago who had terrible hearing, could hardly hear a thing, and I asked her if she would like to be hearing better. And she thought for a minute, and she said, "Well, I think I've heard enough already." So, it sounds almost humorous, but of course, it's a sad case, right? It means that that person has kind of given up and has become withdrawn. For a lot of people, if you ask why hearing clarity is important, they may mention things like, "Well, it's frustrating when you can't hear clearly, or it causes arguments with my spouse, or things like that." But actually, it goes far beyond that, because the type of um, deterioration and damage to the auditory system that creates hearing clarity problems leads to a lot of other problems that you really don't want to be dealing with. We'll also talk a little bit about why some of the typical and supposedly advanced approaches to hearing loss treatment often don't work well, and then some things that you should know if you or a loved one have any issues with hearing clarity, about what really is the best way to approach it. So we'll get into that. Also, want to mention, especially for any of you who don't think you can make it till you might not stay till the end of the presentation. I have a few free resources for anybody who has interest in more information about this kind of topic. We mentioned I did write a book with the neuroscientist Keith Darrow, PhD. Uh, it covers a lot of the typical questions that people ask about treating hearing loss, the effect of hearing loss on brain function, and a lot of other topics you might be interested in. And you can get a free copy by going to hclibookoffer.com. We got quite a few questions in preparation for this seminar about tinnitus. And tinnitus is a problem, it's a very common problem. We'll talk about it maybe a little later. And it's one of those things that there's a lot of misinformation about it. And there is kind of misleading advertising about it. And people try all kinds of crazy things that have no scientific backing. So for anybody that has any interest or any questions about tinnitus, what is the real science behind it, what really works and what doesn't, I wrote a report about that. It's easy to read, but I think it'll give you some good information, some good background for anybody who has any questions about tinnitus. And you can get a free copy. Just go to hclitinnitusreport.com. And I think Michael mentioned that I just came out with this new book. It will be on Amazon. It's not on yet because we just came out with it. But it's meant to be a simple explanation of the basic things that you need to know about hearing clarity. And you're welcome to get a free copy of it. Just go to hearingclaritysolution.com. Okay, so to get into this now, let me just explain a little bit here about what you need to know about why, when we talk about why hearing clarity problems are important, and the far-ranging effects that hearing clarity has on so many aspects of your quality of life, brain function, health. To understand why that is, you have to have some understanding about how hearing works. When I took my first course in audiology, the beginning of the class, the professor asked us, class full of students who didn't know anything about hearing science or anything, asked us what the most important part of the body for hearing is. And most people said the ears. And he corrected us and said, no, it's the brain, because the ears just collect sound, but no matter what kind of sound the ears are collecting, if the brain can't decipher it, figure out what it means, separate one sound from another, doesn't matter how good your ears are, that sound is not going to be something useful to you. So the way that hearing works is sound waves go into the ear canal, right? And hits the eardrum. The eardrum vibrates. The bones behind the eardrum vibrate. There's a chain reaction. That little curled up snail is a cochlea, and the um, the nerves that attach to that curled up thing that looks like a snail go up to the brain, and that's the message eventually goes through different parts of the brain so that you can make meaning out of it. Now, it's obviously more complicated than what this animation shows. And all the research tells us that there are many, many different parts of the brain that are involved in hearing, most of the brain. So there are parts of the brain that have to do with recognition of the fact that you heard a sound. Other parts of the brain that have to do with timing differences, so you can tell which ear the sound got to first, and so you know where the sounds are coming from. There are other parts of the brain that have to do with interpreting the emotion of the conversation that you're listening to, or pitch, rhythm. Memory is involved because you have to remember what a word or a sound is supposed to sound like to match it to what you're hearing. You have to remember the beginning of the sentence by the time you get to the end of the sentence. So it's all different parts of the brain involved, which means that when you have hearing loss, and it doesn't have to be a lot of hearing loss, but when you have some hearing loss, those parts of the brain that are not being, there are parts of the brain that are not being stimulated the way they would have been if your hearing was better because of the interruption or the deterioration in the connection between the ear and the brain. So the parts of the brain that are not being stimulated the way they normally would be start to deteriorate. So that just kind of gives you a little bit of a glimpse about why we have such far-ranging effects when you have hearing loss. And it's one of the reasons why, and I'm going to mention this a little later, that in our office we do cognitive function screening. We use FDA approved, FDA cleared technology to analyze the 5 basic aspects of brain function that doctors usually look at when they're considering um, cognitive deterioration, cognitive decline, and dementia. Because we do that because of the effect that hearing loss has on mental function. We'll talk a little bit later. If anybody has not had a cognitive function screening, we'll talk a little bit later about how you can get that. And we do that in our office, but there's also another opportunity coming up very soon for you to get that for free. And we'll have more information about that. Okay, so yeah, so we see so many patients in our office who have hearing difficulties, and they don't do anything about it for quite a long time. And I think it's because they don't realize sometimes until it's too late what the effect is. Later on, they usually regret it because they realize some of these things later on. So we're going to talk a little bit about increased risk of cognitive decline and dementia. If you do a survey of older Americans and you ask them what is the thing that the health conditions or the thing that you're most concerned about when it comes to getting older, fear of cognitive decline and dementia usually is at the top of the list. Also, increased risk of falls. Falls are the #1 cause of accidental injury and death in senior citizens. And hearing loss increases the risk of falls dramatically. reduce quality of life, frustration, depression. I think anybody who has lived with somebody or been close to somebody who has significant hearing loss knows about the frustration that this can cause and how it disrupts quality of life and relationships. But let's see here. So the good news is that if we treat hearing loss properly, and if we do a good job correcting the hearing clarity problem, there are a lot of benefits that are documented. So the research tells us that if we do a good job treating hearing loss, we improve significantly selective attention, memory recall, and processing speed. You may wonder now, selective attention. Maybe that might be more obvious to you than how hearing loss treatment could improve selective attention. Might be more obvious to you than how memory recall is improved. For selective attention means that if you think about if you go to last time you went to a restaurant and you're trying to have a conversation or a family gathering and there's background noise, the more the connections between your inner ear and your brain deteriorate, the harder it is to focus on what you want to listen to and pay attention. Memory recall, if you have trouble with hearing clarity, you're putting a lot more mental effort into figuring out what people are saying, and you don't have as much mental resources left over to remember what the person is saying. Also, of course, besides the fact that if you don't recall what they said, you can't, if you don't hear what they said, you can't recall. Processing speed also is affected. When you have some hearing loss, because of the deterioration between the inner ear and the brain, the speed that the message goes from the ear to the brain slows down because of the lack of the deterioration in the connections. If we can improve that stimulation and make up for that deterioration, then it's easier to do things like keep up with someone who's speaking more quickly, and so forth. Okay. All right. So just a quick overview here, because when we think about how to solve the hearing clarity problems and what has to be done, it's typical for people to say when they come to the office, I'm having trouble. I feel like I hear okay. I just can't understand sometimes what people say. And that's a symptom of hearing loss. They assume that because things sound loud enough that they don't have any hearing loss. But hearing loss affects clearness before it affects anything else. And this is why. And this is, if you want, you may know of people that have friends or family members, or maybe you yourself, who had hearing clarity problems, and maybe got hearing aids, and still have trouble with hearing clarity. And so, to understand why hearing clarity is such a difficult problem to solve, this will give you a little bit of an insight, because there are a bunch of different mental functions that deteriorate when you have some hearing loss, and that we have to make up for with the advanced technology that we have, and making sure it's customized properly. So, for example, let's show you this. Okay. Orientation. When you have normal hearing, there's a lot of things that happen that you're not even aware of, and because everything's fine and you're not having any trouble. So, orientation. The brain has to compare the sound coming from both ears to be able to orient itself and know what's happening in the environment, where sounds are coming from. This is crucial for a lot of different reasons. One reason is the typical problem that people talk about, which is having trouble with background noise. In order to be able to focus on the voice you want to listen to and ignore the other voices, you have to be able to accurately tell where sounds are coming from. Recognizing sounds. Now, hearing sounds is one thing. Recognizing what that sound is something else. So, with the typical kind of hearing loss that we see, even if you make sounds loud enough so that they can hear the sound. So let's say it sounds in speech like S and F, right? Acoustically, they're pretty close, but a person with normal hearing can easily tell the difference. With the typical types of hearing loss, even if we make things loud enough for you to hear it, if you heard that sound, but if it was an S or an F, and you may not be able to tell the difference. So if it's a word with an S like sat, and you heard it, but you couldn't tell what that S was, it could have been sat, fat, hat, cat, and now you have to make a guess, right? And of course, you have to guess. You have to cross your fingers and hope that you guessed right, right? Um, Focus. You have to use both ears to focus on it. You might be able to hear all the noise, but if you can't focus, then you're not going to be able to follow the conversation. Separating one sound from another. When they all blend together, then you lose. You hear noise, but you can't make out what's being said. Um, you could listen to two people that are talking at the same time. If you have normal hearing, you can decide which person to focus on, and then you can switch from one to another. Um, if we don't do a good job with treating your hearing loss, you hear the voices, but you can't distinguish, and you can't focus on one or the other. You just hear a bunch of noise. Okay. Now, I just want to mention that I should have said this earlier, that this webinar is specifically for and exclusively only for people who are getting older. Everybody else should probably leave now, because the rest of this presentation is not for you. But if you are in that category of people who are getting older, this is for you, because um, the there are a number of factors, risk factors for hearing loss, and some of them you can avoid. Things like excessive noise exposure, ototoxic drugs that can affect your hearing. But there is one risk factor for hearing loss that you probably don't want to avoid, and that is getting older and living longer. That by itself increases your risk for hearing loss. But if we can treat your hearing loss properly, we can prevent the decline, or at least slow down the progression. And one of the things that we're really focused on and really important is to prevent or slow down the progression of cognitive decline, mental function. When we say that hearing loss increases the risk of cognitive decline and dementia if it's not treated properly, you might wonder, why is that? How does that happen? And all the research tells us that there are three factors. So one factor is social isolation. Now, social isolation by itself is a risk factor for dementia and cognitive decline. Of course, you can imagine that it's probably not a surprise to you that all the research tells us that if you have a hearing loss, you're more likely to gradually become socially more isolated, because it's so frustrating and difficult to have conversations. And sometimes it could be even more frustrating for the person you're talking to than it is for you. Another factor is brain overload, cognitive overload, which again by itself is a risk factor for dementia, but hearing loss exacerbates it a lot. Now, you might wonder what we mean by cognitive overload. So think about this. Let's say you're driving your car, going somewhere, and you have the radio on, and you suddenly notice that you're lost. Well, what's the first thing that you normally would do? Probably turn the radio off so you can concentrate on where you're going. That's because the combination of thinking about where you're going and listening to the radio is overloading your brain and makes it hard. Well, with hearing loss, uh, it takes a lot more mental resources to figure out what people are saying than it would have. And instead of just relaxing and easily understanding what someone is saying, so you can have mental resources left over for things like figuring out how you're going to respond or other things, your brain is overloaded, and that is a risk factor for cognitive decline and dementia. Another risk factor that's exacerbated or increased by hearing loss is cerebral atrophy. Right? This might sound unusual or strange to you, but cerebral atrophy, that's we're actually talking there about brain shrinkage. So here is an MRI um, comparison. It's from the Baltimore Longitudinal Study of Aging from the Department of Health and Human Services. And it's comparing the brain of someone with hearing loss to the brain of someone with normal hearing. What you might wonder, why would you have brain shrinkage from hearing loss? Well, in concept, it's kind of simple. It's a complex process, but basically, the type of hearing loss that causes hearing clarity problems happens because the connections between the ear and the brain are deteriorating. So the parts of the brain that are stimulated by the neural connections that are deteriorating, of course, they're not being stimulated as much anymore. And from lack of stimulation, lack of use, they actually start to deteriorate. And if you know anything about dementia, you know that this kind of cerebral atrophy and brain shrinkage is a hallmark of dementia. And go back to this. Okay. How much hearing loss does it take to cause decline in hearing, increased risk of cognitive decline and dementia? Well, this is from Johns Hopkins Medical Center, landmark research. And if you can see here that with a mild hearing loss, you have a 200% increase in the risk of cognitive decline and dementia. Of course, it increases with the severity of the hearing loss. If you have a very severe hearing loss, it could be 500%. But I think a lot of people might be surprised that with a mild hearing loss, you can have a 200% increase in the risk of cognitive decline and dementia. Now, to understand that, it's important to remember what actually is happening when you have a mild hearing loss. So think about this. This research has documented that you can have at least, and actually more, but at least 50% of the neural connections between the inner ear and the brain not functioning properly and still have normal loudness level. Like when you hear beeps in a soundproof booth when they do that kind of hearing test. So before you have a loss of loudness perception, you can already have 50% of the neural connections from the inner ear to the brain not functioning properly, which means you might have normal loudness perception, but you have difficulties with other things like clearness, and you might have tinnitus and other issues. Right. So we'll go through some of this a little bit quicker. This is the typical, family gathering or restaurant that people talk about having trouble in. And when your brain gets the information, it's confusing. It's hard for you to recognize it. You have to guess what people are saying, and so forth. Now, if you know of anyone who, or you yourself have tried wearing hearing aids and had problems, it's most likely there are a number of reasons for that, and we see this all the time in our office. We're able to solve these problems typically, but there are some reasons that I'll go through quickly here why the most advanced attempts or typical attempts to solve the problem don't really do a good job, and why we need to do a better job, and why we're why we using the advancements that we've had. So first thing, it has to do with the evaluation. If you think about, if you've had a hearing test, and you think about, if I ask you, what do you remember about that hearing test? Most people will say that what I remember is that I was listening to beeps in a soundproof booth, and they had me pushing the button to tell them when I heard beeps. Well, I've been doing this for a long time, and when people come to me and say, Dr. Cardano, I have a lot of hearing problems. I mean, if I would ask you, how many people do you think have told me that the reason they have the thing that bothers them the most about their hearing problems is that they have trouble hearing beeps in a soundproof booth, right? Obviously, that's not what people are concerned about. So that typical standard focused part of the test that most people are familiar with doesn't really help much in telling us what we need to do to solve hearing problems. Also, I mean, we have to do a lot of other things. So, for example, we need to do speech and noise testing. You might have remembered, if you've had hearing tests, you might have remembered having repeating words, but it probably was repeating words with no background noise. And of course, in real life, very rarely is there absolutely no background. So that's just some of the things that we need to do. As far as the technology goes, still today, even with what's considered to be top of the line advanced hearing devices, some of the strategies that the technology has been relying on are things that don't really do a very good job of solving the problem in a lot of cases. So here are just some of those things. For example, directional microphones, focusing in one direction, was developed to deal with the background noise, but of course that's not the way normal hearing works. Someone with normal hearing doesn't suddenly become unable to hear sounds from in certain directions. Noise reduction was developed to try to help with this, but of course, if the background noise consists of human voices, then you're not going to be able to distinguish between voices and background noise. So there's a lot of these different situations. Even algorithms developed by engineers, it's not natural. They've done the best they could, but there's limitations because it's not what, in many cases, what is really important to the users. So, question here is what do we need for long-term results and to really solve the problem? One thing we need is the first step is to have an evaluation that really gives us the information we need. So I mentioned about cognitive function. I'm going to mention later on that I was saying that we do cognitive function screening in our office. The evaluation we do in the office is complimentary. If you're curious, we'll give you some information later if you'd like to schedule a complimentary evaluation. But in any case, wherever you can, if you can find a way to do this, if you've never had a cognitive function screening and you're over age 55, you really should. It will, in our office, the technology we use checks these 5 parameters, which is the typical parameters doctors look at when they're concerned about cognitive decline and dementia, and you'll get a score for each of these. One of the reasons we do this is because if we do this as a baseline, if a person has hearing loss and hearing clarity problems, if we do a good job of correcting, of treating the hearing loss, if we repeat this cognitive function screening, let's say 6 months later, we typically see significant improvements in at least some of these parameters. So if you find that you're not doing well in some of these parameters, just keep in mind that it is possible to make improvements. We also want to find out what stage your hearing loss is at. So that's the second thing here. Hearing loss is something important to keep in mind. Hearing loss is a progressive degenerative condition. I don't like saying that. I don't want to When I say that, I'm afraid people are going to think we're using scare tactics or something, but it's just a fact. When you start having some hearing loss, it's typical for that to progress, just like a lot of other conditions. Fortunately, there is treatment, but you should know if you have some hearing loss, what stage your hearing loss is at. This is the equipment that we use for cognitive function screening. It's called CogniView, and it is the FDA cleared technology for that purpose. When you have your evaluation, this is a one-page summary that we give all our patients so they can understand the results of their test. This is the second half of it. You should know what your risk of cognitive decline is based on all the results. You should know if your hearing loss is putting you at risk for traumatic falling incidents or not. We do a test on all for all our patients called otoacoustic emissions testing, which checks to see if there's any deterioration in the neural connections from the ear to the brain. If you remember, I said that you could have normal loudness levels, but you can have that, but with some deterioration of those connections, that's going to cause other problems and also be an indication that the process of hearing loss has started. You also should know what's recommended for you, and if there's any treatment recommended, you should know what the prognosis is, because if we're doing a good evaluation, it's not a question of saying, well, let's try treating your hearing loss and we don't know what's going to happen. We should be able to tell you how much hearing clarity we're able to give you. And just to note, something important to keep in mind, like most conditions, most progressive conditions, the earlier we catch it, the easier it is to do a good job and give you better results. Unfortunately, we see too many people who have waited so long that it's hard to give them good results. But if we catch it earlier, we can do a better job. I mentioned earlier that there are some technology features that are considered to be, I mean, you'll be told that these are advanced features that don't do as much as we would like them to do. Fortunately, now we're able to use artificial intelligence to solve some of these problems. You might have heard lately about what's happening with artificial intelligence and some controversies about it. But when it comes to hearing loss, the artificial intelligence that we're able to use now in hearing devices is making a significant difference. For example, being able to help you tell the difference between foreground and background. I won't go into too much detail about this. It's a type of artificial intelligence called deep neural networks. And if you have about an hour and a half, I can go into this with you, but it is interesting. It's been trained on 12 million real life sounds. Instead of having an engineer try to think of what the hearing aid should do, it learns what to do, similar to the way a child learns language. A child doesn't learn language from reading a grammar book. A child learns language from experience and trial and error, which is the way this technology has learned what to do. A few important things here. No matter how advanced the technology is, it needs to be verified and validated. We need to do things like test the device while it's in your ear to make sure that, this is some of the technology we use, make sure that you have an accurate prescription. All the recent surveys tell us that unfortunately a lot of health hearing care practices don't bother doing this because the manufacturer's software gives you an initial setting, and unfortunately that's just an estimate, it's all too common that it's just left that way, and it could be, in most cases, it's way off. So we have to make sure that's be careful about verifying and validating that everything is customized properly. And the laboratory data tells us that if we do all this properly and we use the right technology, compared to what we were able to do not too long ago, we increased listening comprehension, speech understanding and noise, memory recall, access to acoustic detail, and so forth. Okay, so um, I know I'm going to just go through some of this other material quickly. Um, when you have, if you treat your hearing loss properly, this is an ongoing process. Uh, I've had some patients ask us, well, okay, I know, say to us, well, I know I say I have this hearing loss. I know it has to be treated. For how long will I have to treat my hearing loss? And of course, this is like any chronic condition where there is effective treatment, but not a cure. This is treatment that is ongoing, and it's not something where there's a time limit on it. So, it's similar to um, if you think about diabetes, right? If you're diagnosed with diabetes and you ask your doctor, how long will I have to treat my diabetes? What do you think he's going to say? Right? Um, as long as you want to stay healthy, right? So treating your hearing loss is a long-term, ongoing project. We want to make it as simple and easy as possible. So you need to remember that uh, we need the initial proper evaluation. We have to customize the technology properly, and it has to be adjusted and maintained over time. We know that the because it's a progressive condition, we know that hearing clarity is going to gradually deteriorate over time. Fortunately, the good news is, as your hearing clarity deteriorates, the technology to address it and improve it is improving. So we need to make sure that we're updating the technology as time goes on. It's why at our office, if you look at the bottom of this list, we have two different types of guarantees. One type of guarantee is that we're going to maximize the patient's hearing clarity potential so that they're comfortable and satisfied with the way they're hearing within the first 60 days. But of course, we're concerned about what happens beyond the first 2 months. And so the second part of the guarantee with the treatment program we use is that as your hearing changes and as the technology improves, we're going to be able to update your hearing technology without any increase in the monthly cost. So anyway, that's just some of the those are just some of the things to keep in mind, right? I'm just going to go through some of this quickly. This is just some of the people that we have helped. Uh, this this guy's a character. He's a Latin dance instructor who had trouble in social situations where he was teaching dance, and we're able to help him. If I think a lot of people know friends and family members who have had trouble uh, correcting their hearing loss, and don't know anybody that's done well. So if you're curious, this is a place where you can see some people talking about getting their hearing loss treated. I'll go through some of this. I was going to play some of that. I should give you our contact information if you wanted to schedule a complimentary consultation, which includes that cognitive screening. And just to wrap this up before we get to questions, these are the free resources I mentioned earlier. You're welcome to get a free copy of the book that I wrote with Dr. Darrow. You're welcome to get a free copy of the tinnitus report. I think you'll find that really interesting. And the new book. I'm supposed to mention that I'm doing a book signing at the Malvern Cinema on the 10th. but you can get a free copy at hearingclaritysolution.com. And I think that's it. So did I? I hope I ended on time and didn't test anyone's attention span.
No, I mean it's no, that was all great stuff. I think everybody was pretty glued to all of that. So I mean, who knew there's so much is involved with hearing?
Yeah, most people consider. I mean, most people, if you don't, if you're not studying it like I do, it seems like a simple thing. You would think either I hear or I don't, right? And I've had patients tell me, well, I don't hear my wife so well, but who cares whether I hear her or not? You know, um, and it sounds humorous, but it's not that simple. It's not a matter of just, well, I heard, I missed this once in a while, I missed that once in a while. Um, it has such far-ranging effects on mental health, quality of life, that people don't think about. Um, you know,
Yeah, great. And by the way, so while you were talking, we did actually get a question that came in through the chat room.
okay.
I think it's a pretty good question. You probably hear this one a lot, but Norman is asking, how often do hearing aids need to be replaced?
That's a good question, and there's actually been a lot of research done on this. Uh, Remember, I was saying earlier that two things happen over time that relate to this. One thing is that we know hearing clarity, even if loudness doesn't change, hearing clarity gradually deteriorates over time. And we know also that the technology for improving hearing clarity improves, right? So all the research is telling us now that by the time about roughly 4 years goes by, um, the way the typical hearing loss progresses and the way technology has been improving, by the time about 4 years goes by, you're at a point where the difference between the way you're doing with that technology that you have and the way your hearing loss is compared to the way you would be doing if you updated your prescription and updated technology is really significant. So by the time to make it simple, I would say by the time about 4 years goes by, the technology is really outdated for most people, and can do that. In our office, we do testing, um, speech and noise testing with the previous hearing aids, the old tech hearing aids, and the new technology to document what the improvement is. Yeah.
Excellent. And by the way, so we were talking about this actually before we started the presentation tonight, but I guess it comes down to tinnitus versus tinnitus, and I was
Yeah.
trying to say it the way you said it earlier, Dr. Cardano. So
Yeah.
I'm sure that when I listen to you
Well,
and your presentation, like, oh man, I really messed up. Even
yeah. Well, it's a funny thing because and I know a lot of people are concerned about tinnitus, and we treat tinnitus all the time in our office. People tend to be, I don't know what it is about this, but some people want you to say tinnitus, some people want you to say tinnitus. And I've had people that get very upset if you don't say it the way they think you should say it. I'm not sure what that is, but whatever it is, it can be very annoying, right? Um, and too many people are told that there's nothing you can do about it, um, where there really is effective treatment. It's why I wrote that report that you can get at HCLI, tinnitusreport.com. But we've seen so many people that suffered with tinnitus for so long unnecessarily, when it could be helped. Yeah.
And it's funny, like you can probably hear it in my voice, but I think I'm going through allergy season, so my sinuses have been stuffed, but so have my ears. And so I've been having some tinnitus in my ear as well. So I get, definitely understand that. But someone asked, what can you do for tinnitus when going to sleep? So how do you sleep with
Yeah.
that buzzing in your ear going on?
Why that is a typical question because you have to understand to make sense of this and to know what this to understand this, you have to know what tinnitus generally is and what causes it. Tinnitus in general is the result or the neural consequence of damage or deterioration of the auditory mechanism, the connection between the ear and the brain. Means that the brain is not getting all the stimulation that it normally would get if the auditory system was in good shape. And so it's something like what happens if you've heard of phantom limb syndrome,
Mhm.
right? Where people have heard this, where someone has, let's say, an arm amputated, and the arm is amputated, but they still feel as if they have pain in that arm that's not there. What's happening is that the brain is accustomed to getting, stimulation from that arm, and when that arm is gone, the brain kind of makes up stimulation that it's missing. So when you're missing the auditory stimulation, the brain kind of makes up something instead, and that's tinnitus. So a lot of people, when it comes to things like sleeping, with the reason why people are concerned about have trouble sleeping, especially, is because things are quiet, right? So in most cases, people are more bothered by the tinnitus if they don't have any noise around to kind of have that extra stimulation and drown it out. So, a couple of things. The typical, if just practically, so the typical recommendation used to be, if you would ask a doctor or an audiologist what to do when I go to sleep, when you go to sleep, the standard typical recommendation was always, well, try to have some kind of noise like a radio, or there were some of those noise machines that are supposed to be relaxing, where you have a babbling brook or rain or something, right? So that can be helpful to some extent because it's the silence that you're trying to avoid. But here's another thing that helps a lot: relaxation techniques, being relaxed, because the limbic system is part of the nervous system that deals with emotion responses, can make tinnitus more annoying if it gets fired up. So if you're nervous, tense, worried, it actually makes the tinnitus worse. Something interesting to note is that all the research tells us that the loudness of the tinnitus is not correlated with how annoying someone says it is. There are people that have tinnitus that's pretty loud, but they kind of don't let it bother them. They think about other things, and or they're not excited about it. They kind of doesn't don't pay attention. There are other people that have tinnitus where it's not very loud. It's pretty soft, but they're so worked up about it that it drives them nuts. So, if there are any relaxation techniques that you can use, like meditation, things like that, I've used just a simple type of meditation where you follow your breath and you repeat a word like release. But any meditation or relaxation techniques you can use before you get to bed can help. The last thing, though, number three, is if you have tinnitus that's bothering you when you sleep, it helps a lot if you're treating your tinnitus properly during the day, because there's generally a residual effect. The most commonly effective um, treatment for tinnitus, based on all the research and the Academy of Otolaryngology um, guidelines, is properly used customized hearing aid technology that's designed for this purpose to give you the stimulation you're missing. But if you're treating your tinnitus properly throughout the day, it's kind of a residual effect, so it doesn't bother you so much at night. So I know that may be a long-winded answer, but I hope it helps.
No, but a good one for sure.
Yeah, yeah,
Um, so Anna actually shared in the chat that she likes to wear AirPods and listen to music while she jogs.
yeah.
How is this affecting her hearing, and what volume should she not go past?
Okay. Well, it's an interesting thing because apparently Steve Jobs had some hearing loss. So initially, when they developed the the iPod, um, they they were allowing the volume to get up, you know, too loud. I would just say this: uh, if you have any kind of if you have any tinnitus, have any ringing in your ears after if you listen to the music, it means it's too loud. in general, I mean, it's hard to say exactly what volume level is gonna be, damaging to you. I will just say that the more time you spend, the damage to your hearing is affected by the loudness, but also the amount of time without a break. So if you're going to be listening to music on your iPods for a long time, if you could take a 5 minute break once in a while, maybe every 20 minutes, it will reduce your chance of damage, right? Um, the other thing is listening to music in a noisy place. Now, if this is the problem, if you're jogging in a noisy place with traffic, you're probably going to be turning the volume up higher to compensate for that. So you have to be a little more careful. But I would just say the best you really can do practically is have it just loud enough that you can hear it, and not any louder than that. Take a break for about 5 minutes every 20 minutes or so, and that should help.
So if we were to come in for an evaluation, if we were going to do that, first of all, Cindy's asking, how do you arrange that? How do you arrange to
Right.
get it?
Right. Well, I should mention that what the evaluation we do in our office, it's extensive. It goes way beyond the typical quote complete audiological evaluation, and you'll get a very interesting summary sheet of all your results and what they mean, to take home. We do it complimentary, so all you have to do, there's two easy ways to contact our office to set up a time to drop by. One way is you can just email us. It's info@hearingcenterofli.com. I don't know if I should put that in the chat box. Info@hearingcenterofli.com. And or you can just give us a call. And the phone number is 516-871-3698. I'm not sure, Michael. Should I put that in the chat box or?
Yeah, we'll have someone put it in there for you. So
Okay. Yeah. So it's info@hearingcenterofli.com.
yeah,
And
definitely.
the phone number 516-871-3698. When you set up a time to drop by, we'll send you some interesting information, and you'll go home with an interesting summary that it's easy to understand, what your results are.
Excellent. Yeah, very cool, very cool. So if we do actually show up for our hearing exam, I don't know, I'd be nervous about it.
Yeah.
But I'm sure there's no reason to be.
Yeah.
How do we prepare for it? Like, should we,
Yeah.
wash our ears extra carefully?
That's good. Good question. I mean, I've people who sometimes people don't know what to expect. I had people ask me, is this going to hurt? Or no, it's not. It's not going to hurt. But actually, we are going to part of the evaluation. We will use a video otoscope to look in your ears. You'll actually be able to see in your own ears with the camera we use. Nothing special to do as far as that goes. It's normal to have some, people are concerned about wax and so forth. It's normal to have a little wax. We just don't want you to have too much. And but the way to this really the way to prepare is to get a piece of paper and a pen and write down what are some situations where you think you might have trouble hearing, right? And if you have a loved one, someone that you live with, a spouse or a child that you live with, if you rate your hearing on a scale, how you feel that your hearing is on a scale of 1 to 10, where 10 is perfect and a 1 means you can't hear anything, but then have that family member rate your hearing, because often it's not the same. Right? You can imagine, right? And I mean, it's not. I mean, it is true. Some people will, are don't want to admit that they're having trouble. But even besides that, hearing loss happens for most people very gradually. So um, the person who has the hearing loss if they would develop that hearing loss overnight, it would be more noticeable, right? But because it's happening slowly, they get used to it until we correct it. But the person they're living with knows that they're having to repeat themselves. The person missed what they said. A lot of symptoms of dementia are similar to symptoms of hearing loss, where it looks like the person forgot what you told them, but they didn't really hear it to begin with, or they seem to be confused. They're responding inappropriately. Um, so those are the main things. Think about, write down situations where you think you're having trouble hearing. Um, and rate your hearing on a scale of 1 to 10, but try to get a family member to rate your hearing also. So when you come into the office, then, and I will tell you that our patient care coordinators are going to help you to prepare. We'll go over a little bit on the phone what to expect, so there won't be anything to be nervous or concerned about. So, but those are the simple ways to get to start getting prepared.
And that's
And bring a family member with you if you can, because hearing loss doesn't only affect you; it affects people around you.
And what's interesting when you say that too, because that kind of makes me think that it's not that it might not be always that somebody just doesn't want to face the fact that they might be losing their hearing, but that just over time just learn how to compensate for it, where they might not even, that they're missing stuff. They probably just don't even think about it anymore because they're so used to missing certain things that they
Yeah.
they don't realize to what extent their hearing loss is.
Right. And to some extent, when you miss something, you don't necessarily know you missed it, right? And if you think they said something and you assume that you're right, and unless someone actually is bold enough to tell you, you know, you didn't get a word I was saying, or you completely misunderstood. I mean, most people are more polite than that, and they're not necessarily going to tell you that you misheard them.
Yeah.
Uh, and so, yeah, besides the denial, um, I've had eye doctors tell me that sometimes when people haven't had eyeglasses, but they've had some hearing issue, some vision problems, when they first put their eyeglasses, they say, "Oh, I didn't realize it was supposed to look like that." And similar thing happens with hearing. Yeah.
Yeah, I mean, it's funny. I think when I first had to get glasses, I didn't realize like how bad my sight was until I drove down the street and realized I could read street signs all of a sudden. So
You're supposed to be able to read those things, right?
that's right. It's like, oh, your mind just says, oh, I don't need to read those.
You
So
assume everybody, yeah, you assume everybody else sees like that, like just like you do, right? But yeah, but that's why usually when we make that correction, if people say, "Oh my gosh, what was I doing all this time?" Yeah.
yeah. Well, absolutely. Well, thank you so much for all of this valuable information that you gave us tonight, Dr. Cardano. And by the way, if you have other questions, I know we couldn't get to all of them, but if
Yeah.
you have questions, want to meet Dr. Cardano, you can actually do that this Friday, May 5th. Just come out to the Harold Senior Health and Beyond Expo that's happening at the Rockville Center Recreation Center. It's running from 11 a.m. to 2 p.m. We can get you information if you'd like to learn more about it. I'm sure you'll get an email if you sign up, and you'll get more information about that. But it's the Harold Senior Health and Beyond Expo at the Rockville Center Recreation Center, running from 11 a.m. until 2 p.m. this Friday. So Dr. Cardano will be there. So will a lot of other people. It's great stuff. So,
Yeah.
I'm excited to go get out there, Dr. Cardano.
Yeah, we're looking forward to that. And I would invite anybody who wants to drop by and say hello if you have any questions. That's this Friday. Also, we will be doing cognitive function screenings.
Oh,
So
wow.
if you've never had a cognitive function screening, drop by. It's free, and you'll get some interesting information about how your brain is working. Yeah.
Well, great.
Yeah. And if anybody has any questions we weren't able to get to, you can either drop by Friday or you can use that email address, info@hearingcenterofli.com. You can shoot me an email and I'll try to get back to you about your questions.
Fantastic. And by the way, if you want more information or questions about Harold Inside LI webinars, which is what you're watching right now, feel free to email us at insideli@liherald.com. That's inside LI, just like Long Island, at liherald.com. Thank you again, Dr. Cardano. On behalf of everybody here, I'm Michael Hinman. Thank all of you for joining us and have a great evening.
Thank you.